for everybody. So thank you so much for everyone being here today. I really appreciate it. Today, we're going to learn all about chronic spontaneous urticaria, which is a condition that we see a ton of. My name is Dr. Nikhil Joshi. I'm the director of the AIM Center, which is the Allergy and Immunology and Internal Medicine Center here in Calgary. I really love treating CSU, or chronic spontaneous urticaria. It's my main area of interest, and I think I really appreciate it because the patients are really wonderful and are going through a difficult time. And so to be able to help that means a lot because my past was I was previously a patient. What is urticaria? Urticaria is a fancy name for hives. It's a condition where you can get different hives or swelling or both. Hives have wheals and flares. They have redness, they're itchy. There's many different types. Sometimes they're flat, sometimes they're raised, sometimes they're small pinwheel dots, but often they're quite itchy. And the pruritus or itch is what makes life so difficult. In extreme cases, it is head to toe and really impacts people and causes lots of visits to the ERs. Angioedema is a fancy word for swelling. It's swelling that happens under the skin. And oftentimes we see it, especially on the lips, tongue, and eyes. Rather than being itchy, sometimes they describe it as painful or burning. And it takes a lot longer for angioedema to go down. There are two types of angioedema. There is histamine derived, which is 90% of angioedema. And then there's bradykinin involved angioedema. And those are different, but the histamine one is luckily more prevalent and easier to deal with. What is, how do we look at urticaria? We break it into acute and chronic. Acute is when it lasts less than 6 weeks, and chronic, as you guessed, is when it happens all the time. With chronic spontaneous urticaria, there's no obvious specific external trigger. For chronic inducible urticaria, there's often a specific trigger, and that trigger can be cold, pressure, heat. Those are very common. Cholinergic means sweat derived. Why do these different ones come about? Well, acute most of the time is caused by idiopathic, which just means we don't know. What we often see, however, is that infections play a large role. And in most cases, after seeing so much urticaria, what we realize is that many times patients have an inciting event. They don't know what that, they don't know what about that event does it. So, for example, I saw a patient who, after a motor vehicle accident, started getting recurrent urticaria. I saw another patient who had IUD insertion cause recurrent urticaria. Another patient who was pregnant. So what we're realizing is that there's an autoimmune component to this, that there is often an idiopathic. It's just a fancy way of saying that we don't know, but realistically, there is a trigger mechanism there. This is not an allergy, although it makes lots of people believe they have it because it has many of the features of an allergy. You have a rash, you're itchy, you might have some swelling. All of this sounds like a typical allergic reaction. So that's why allergists see so much of this condition when it's really an immune condition. People with CSU, how do they present? Oftentimes they have just hives. Some people have hives and swelling, and some people have swelling only. Of these, the most difficult to deal with is the hives and swelling. How common is this? About 1% of the population and it's twice as many females as males. The incidence is usually between 20 and 40 years of age. CSU can be really long lasting, and that's what many people find very difficult. Imagine being itchy every day of your life for years. What we find is that many resolve within 6 months, some take 3 years, and more take 5 to 10 years. It is really difficult to expect that of patients to wait for a resolution. That's why treatment is so important in this condition. The risk factors for this sticking around longer is the more severe your symptoms are, the more likely it's going to stick around. If there's swelling, that usually indicates more severe disease. And if it's inducible, if this happens because of heat or cold or sweat, that usually also indicates stubborn disease. 50% of patients experience at least one reoccurrence of chronic urticaria after spontaneous resolution. CSU is a really tough disease for patients. It affects them. It affects their activities of daily living. The first thing I see that people often have difficulty with is what to eat. I find that many of my patients find that foods can sometimes trigger this condition, and so they wonder whether they're allergic. Oftentimes they start cutting out foods that they previously loved, and then they try and eat less and less and less. This also can cause anxiety. This can cause stress. And then eventually people may start restricting themselves. They may not feel great about going to work. They may not feel great about exercising. And they may be worried about their social functions. They may be really worried about going out to a wedding if they get itchy rashes or swelling of their lips. So, this condition impacts people's quality of life. And that's why I like treating it, because I want to give people that quality of life back whenever I can. 1 in 6 patients have visited an emergency room in the last 12 months due to CSU. And that's often caused by terrible rash, swelling, and in some cases, anaphylaxis. There is more depression, anxiety, and difficulties in CSU than psoriasis. And that's very interesting for the medical community because we know a lot about psoriasis, but chronic urticaria is a relatively unknown condition for many practitioners. And that's just because allergy and immunology isn't probably as well taught in our medical schools as they should be. Patients often suffer from social isolation, depression, and anxiety. And so fixing this problem really helps people come out of their shell and enjoy life again. There is a recommended treatment algorithm that comes from the World Allergy Organization. The first line is second generation H1 antihistamines. What does that mean? That means not the older antihistamines like Benadryl and hydroxyzine. These older antihistamines cause things like weight gain and memory loss. And so we've decided to let them go. Second generation H1 antihistamines include things like cetirizine. The brand name is Reactin. Other things including desloratadine. The brand name is Arius. And then newer antihistamines like rupatadine and belastine, the trade names being Rupall and Blexten. So the first step is to get on antihistamines. The second step is to go up to 4 antihistamines a day. So a 4-fold dose. Lots of people don't end up on that dose, and that's because they get worried that they're taking too much. After the antihistamines, the next case is omalizumab or Xolair. This should be done under supervision of a specialist. Omalizumab is known as Xolair, is a monoclonal antibody or biologic. This biologic is one of the only ones or the only treatments for chronic urticaria. The downside is it's not covered by public health care. So it has to be covered by insurance. And even then, some insurances only cover it by about 80%. This is still out of the reach of many patients who understandably have financial issues, as the medicine is expensive, anywhere between $1,000 to $1,200 a shot. Clinical Trial Hero is an app that I created to help people who have chronic illnesses. My story is that before, while going through residency, I was a cancer patient. And becoming a cancer patient, I learned a ton about what we do great in medicine and what we don't do well. And I wanted to change that. I wanted to help people with chronic illnesses. So we include guided meditations for people with chronic illnesses. And I eventually wanted to speed up the clinical trial process. I found the clinical trial process to not be centered around patients at all. I found it to be centered around doctors. It's more about, do you have the right doctor? And if you don't, you'll never hear about the trial. So to try and fix that, I created Clinical Trial Hero. And currently, we're investigating Clinical Trial Hero as a way to help people with chronic spontaneous urticaria. Thank you so much for this. I'm going to just turn off the recording and then we can have a brief discussion.